Thank you, Dr. Sabin. Let me just go to an online question and I'll come back to the room. I do realize that we're at time, and I'll ask first our speakers if you could spare another 10 minutes for us to get a round of questions in the room. So this online question is for you, Claudia, and it's about how is Africa CDC advocating with government on increasing the budget for health ministries to improve infrastructure, equipment, research and innovation towards improving healthcare, inclusive of emergency response to disease outbreak and epidemics? It's a very long question.
Thank you so much. It is a very long question. But yes, as I've mentioned, that we had a meeting that was hosted by government of Rwanda. President Kagame is our champion for domestic health financing in Africa. And at that meeting, presidents made a commitment that they would like to look internally and find money to fund health. And they've tasked Africa CDC with AUDA, NEPAD, and AMA to go and work out a framework on domestic financing and present to the heads of states for a decision in due course. We're working steadfastly with AMA as well as AUDA, NEPAD to come up with that framework that will propose tangible actions that governments can take to be able to increase funding for the health sector. So it is something that we're working on and we'll be presenting to the heads of states in a matter of months. Thank you very much.
Thank you, Claudia. Now in the audience, I see Solomon, and I'll take one from this side.
Thank you. My name is Solomon Serwanja. I am a journalist from Uganda. Dr. Githinji, in 2023, you asked a very significant question. Does the center hold? We were hit by COVID. A lot of what we're discussing was how can we strengthen our health systems? We discussed in this room and in the main conference center. As a continent, we thought we could learn a lot. As COVID waved out, our priorities shifted and our governments focused on other things rather than strengthening our very health systems. We have been hit once again as a continent with the abrupt reduction in global funding for health, and Africa's been hurt again. It's another shock deeply hurting us. Are we learning from our past? Is Africa really serious about this question that we keep asking every year? How can we strengthen our health systems? It's the same question we were here in 2023. Can we account to the African people whether indeed our governments are serious about strengthening our health systems? And I'll need to ask you again, Dr. Githinji, does the center hold?
Thank you, Solomon. Githinji.
The center is shaky. And I think recently when I was here, again hosted by Minister Sabin, we had a meeting on NCD Forum. And I talked about the danger of the collapse of the African health systems. And the reason I said that is because of back to this question, that if you go deep down to medical economics, if there was something like that, health economics more recently, is that if you took the population of sub-Saharan Africa, leaves Northern Africa and South Africa, and you say about 1 billion people, and you do your arithmetic on GDP available, tax efficiency, how much governments are collecting, how much they can allocate to health, you'd be very fortunate to end up with $40 per person per year, 40. If you did the same arithmetic for pick in a country, in the high-income countries, pick Netherlands, pick Sweden, any country, a similar arithmetic will give you $4,000. So we have an economic problem. So the fiscal space is foundationally the problem. And this is why population development is a critical aspect of investments in health. That population development means that every girl, every woman has a choice on when to be pregnant, how many children to have, and that choice is supported by policy, by resources, so that we have well-planned families. Right now in Africa, in my country, 1 out of every 4 girls between the age of 15 and 19 are pregnant or have a child. That means you have started in generational poverty. Those issues must be addressed for the center to hold. These are structural matters. And when you talk about the health system investment, it is a result, a subsequent of the socio-economic development in the country. Now, let me then come and say, how do we, because these are long-term, population and economic architecture is a long-term thing. It doesn't happen overnight. So what do we do in the meantime to make the center hold? I think that the solution for us, when you have little money, you have no money to throw at the problem. Therefore, we must rethink what we called up many years ago in 1978 in the Alma Ata Declaration and go back to primary healthcare. Because primary healthcare, as you heard earlier, is what is serving 80% of our people. But when you have little money, but most of it is geared towards tertiary and secondary care, then it means that Africa countries are waiting for the floor to get wet to mop it instead of stopping the leaking tap. We must shift our little money to the leaking tap for the center to hold. What do I mean? We must focus on water, clean water for everybody. We must focus on sanitation for everybody and stop open defecation. And we must focus on food and food systems to stop the NCD agenda, the NCD risk. And we must focus on immunization. If we can redesign our health system to make these the core pillars, the center will hold. But it needs bold decisions by policymakers to fracture the current system and to shift back to primary healthcare. It's possible.
We'll take one last question from this side before we close.
My name is John Masenze. I work with the New Vision and SciDev. I have one question to Dr. Chikwe. So we have been implementing the ring vaccination strategy. I just want to know its impact and the lessons learned. WHO has been implementing and advocating for the ring vaccination strategy, especially with the rising outbreaks and health threats. What has been the lessons learned and its impact?
So thank you. Very specific question. Vaccination strategies are a complex thing, and they are specific to the specific both virus and context where this evolved. The ring vaccination strategy is really an old strategy. It developed in our effort to eradicate smallpox. That was actually the first time it was implemented to scale, and led to one of the most significant achievements we've had in global health altogether, which WHO was at the heart of, and we celebrated this first disease that led to eradication. It was developed further for the Ebola virus disease during the West African outbreak in Guinea. And with the benefit of that knowledge developed in Guinea has been implemented in many other countries in DRC and for other filovirus outbreaks, including Marburg and Tanzania. So it's just to illustrate how a strategy for the deployment of a vaccine that is very unique in a specific setting has been successfully developed and deployed. Now, its utilization in other contexts. Right now, there's an adapted model being used for Mpox in many contexts where the disease is happening. And we are learning again. It's why for every new emergence, every new deployment, there's always a very strong research effort around it. And I see some colleagues in the room that are leading on those efforts around the continent. And it's very important to learn from every outbreak. And very proud of the speed of deployment of various research opportunities during the Marburg outbreak in Tanzania. The ring vaccination approach using a new vaccine for Marburg for the first time was the first time it was deployed. And so the knowledge in our space is very incremental. We learn a little bit from one context, we use it for another. So in science, very often we reflect with a lot of nostalgia to the Alexander Fleming discovery of antibiotics. But unfortunately, those big discoveries don't happen like that anymore. The science that we need to develop our area of work happens very incrementally. And what we learn from Rwanda, we'll use it for the next context, and we use it for the next context. So to end up with your question where we started, the ring vaccination approach is a unique and fairly new approach adapted from smallpox used successfully to develop new vaccines for Ebola, and now being tried for both Marburg and Mpox to see the utility of its deployment. And that's really the value of having organizations, regional organizations, global organizations that can connect the dots from one situation to another, and make sure that as a world, we learn from the science that we collectively developed and make sure it serves humanity more broadly. So thank you.
Thank you, Dr. Chikwe. So that was our last question. If we'll allow just a few seconds per speaker to give your closing remarks, just any key takeaway messages. Right after this, before I go to that, right after this, we will have a continued press briefing with Dr. Chikwe only. So we'll excuse everyone else and continue with Dr. Chikwe. Closing remarks, Dr. Claudia, I'll start with you.
Thank you very much. I think we have given you a mouthful. Issues around building climate resilient, epidemic ready primary healthcare systems. I think that's coming out very clearly. There's the issue of domestic financing and how member states can come together and decide how they will fund healthcare system in within the context of the current developments. But the one last thing that I want to end with is we need our sovereignty as Africa. And that will come from us manufacturing our own medical countermeasures, therapeutics, diagnostics, as well as vaccines. If we get that right, I think the center will hold Dr. Githinji. Thank you.
Thank you very much, Dr. Claudia. Dr. Githinji, Dr. Sabin, I'll come to you last as our host.
I think the thing I would like to say is that, as I said earlier, on this issue, because I think the mood around the conference now is the pull out, the sudden decline of resources. That's what the mood is. People are like, what do we do? What next? I think the thing I would like to say is that if we shift our mindset from these resources that are leaving our continent, if we shift our mindset from our institutions and our governments, and we shift them to protecting the communities that were beneficiaries of these funds in the first place, it would allow us then to go back and repurpose, because we are focusing not on the institutional money, AMREF, we don't need to be here if the communities are served. So if we shift our mindset to that, to say, how do we protect the vulnerable communities that were the recipients of this promise? That should be our first step. And I hope that in this conference, that's what we should focus on. I think the last thing I want to say is that we have 56 countries represented at this conference as of today, 56 countries. We have more than 1,500 delegates registered in person and thousands online. We have more than 180 partners at this conference. That is despite the fact that some civil society organizations pulled out because their funding, which was originally targeted from their funding of the US government, did not come through. These numbers give me hope that together humanity will always get together to solve this problem. Thank you.
Thank you. Dr. Chikwe?
Thank you. Firstly, just to congratulate Githinji and the team and everyone organizing this conference for the thought leadership coming out of the continent. And you would see very often you hear the voice of our DG, Dr. Tedros, using his voice to advocate, whether it's peace in the Middle East, whether it's access to vaccines, for whatever the topics of our time is. So I think projecting our voices on issues that matter, especially that matter to us, is not a nice to have. It's part of our responsibilities. And doing that, this conference really enables us to do that. And the World Health Organization is very proud to be part of that conversation. Some of the problems are hard. There are no easy solutions. I think all the easy solutions have happened, and even the easiest ones, vaccines that work at 97%. We can see outbreaks happening in some of the most developed countries in the world. So sometimes you have easy solutions, but they're hard to deploy. So it shows the complexity of our space. It shows why we have to come together as a world. And yes, I do think sovereignty is important, and I've been the biggest advocate of that. But I also think that we should be proud to have a voice in the global community and not to shy away from being active participants in shaping our own future and our own participation in global conversations on things that matter to all of us. So very excited about the conversations that will happen in this room in the next couple of days.
Thank you, Dr. Chikwe. And finally to you, Dr. Sabin, our host, thanking you again for welcoming AHAIC to Kigali.
Thank you very much. I'll be brief because I 100% agree with my colleagues, panelists' points of view and questions from the media family. The center must hold because we don't have another choice. This is our health, this is our systems, and we can't go back. So we have only one option. And that is our determination. That is our strength, that we are going even to think beyond the traditional ways. We're going to own our systems, our health, because we can't delegate to someone else. And that someone else pull out overnight. And we are panicking. There should be no panic. We should own it and even run it better than before. That is something all our countries, systems, and all my colleagues, ministers of health, will be joining us this week. So we'll be reflecting on how this should be our goal moving forward. And as I said before, it's not about how much you have or you spend. It's all about how you spend it and where you spend it and what you want to achieve. And that is, again, the simplicity of our system, the adaptability of our system to our needs. We don't want to do things as it has been designed sometimes back. We have to look at what are our health problems. We have malaria. We have teenage pregnancy. We have stunting. These are the big issues our systems are dealing with, and address it with our local solutions. And within the means, the $40 you mentioned versus $4,000, you can actually achieve the same results if you are creative and intentional about what you want to achieve. And last, I want to repeat how technology, the AI as an example, we talk about AI all the time in conferences, but it should be, for us as a continent, it should be an equalizer. It should be a solution to even catch up with hundreds of years we lost with this legacy of health problems, financial, because these models, these algorithms can be created to replace some of the resources we don't have. We can do faster, efficiently, and better. And we have infrastructure already to make it happen. So let's discuss all this the whole week. We are together. It's a very successful event already, looking at the registrations, the numbers, the countries that are coming. And the program is quite interesting. I know that we have even a walk for the change tonight, a night run, night walk. I look forward to join you all for the run, for the walk, so that we continue to reflect, to be healthy, to even prevent these non-communicable diseases. Thank you so much.
Thank you very much. Thank you. So again, thank you to Dr. Chikwe, Dr. Githinji, Dr. Sabin, and of course, Dr. Claudia. As a good African family, we will take a group photo. If I say no to that, I think all the comms people will jump on me. So we will just stand right here and take a group photo. And then if Dr. Chikwe can just stay behind. And how long is this one? 30? Briefing. Yes, ask her if she wants to, then I'll hand it over to her. Yes. Are you moderating it? Okay. Okay.